All right, this week we're going to talk about the musculoskeletal system. Musculoskeletal system consists of bones, muscles, bone marrow, joints, cartilage, tendons, ligaments, and bursae. The human skeleton has 206 bones and 600 muscles. Joints form the union between bones and allow for movement. The function of the muscular system is movement, posture, joint stability, and heat production. The functions of the skeletal system are to provide a framework for the body, to protect the soft body parts such as the brain, also the storing of calcium, and support and protect bone marrow. That's where blood cells are produced. The organs and structures of the musculoskeletal system work together to protect, support, and move the body. There's a lot that goes into this system and a lot goes into this chapter. I'm going to cover some of it, but you're definitely going to have to do some reading and studying on your own. Before we go over some specific bones, these are some important parts of the bones. So the diaphysis is the shaft of a long bone. The epiphysis is the end of each long bone, or epiphyses is plural. Bone marrow is material found within the cavities of the bone. There's red marrow, which is thick blood-like material found in flat bones and the ends of long bones, location of blood cell formation. And then there's yellow marrow, which is soft, fatty material found in the medullary cavity of long bones. These images here on the screen have an anterior and a posterior view of the skeletal system. Some of the bones seen on this images are the maxilla, which is the upper jawbone, the mandible, the lower jawbone. The vertebral column is made up of bones called the vertebrae or vertebra. Is singular, vertebrae is plural. That's your spinal cord runs through this vertebral column. So your spinal cord is part of your central nervous system. It's a big nerve. The vertebral column protects the spinal cord. It's broken down into cervical vertebrae, which are a set of vertebrae that form the neck. Thoracic vertebrae, they form the upper portion of the spine. The lumbar vertebrae is the lower portion of the spine. Your sacrum, the next five vertebrae below the vertebra, which are actually fused together, and they form a triangular bone positioned between the hips. And your coccyx, which is four vertebrae fused together that form the tailbone. A laminae or a lamina are flat plates of bone that form the vertebral arch, the posterior portion of the spinal canal. You can also see a clavicle, which is your collarbone, scapula, which is your shoulder blade, sternum is your breastbone, humerus, upper arm, ulna and radius form your lower arm, carpal bones are your wrist bones, metacarpal bones are hand bones, and your phalanx or your phalanges are fingers and toes. Pelvis, three bones fused together that form your hips. Your femur is your upper leg bone. Tibia and fibula form your lower leg bones. Patella is your kneecap. Tarsal bones are your ankles. Um, Metatarsals are your foot bones. So that's a little bit of an overview of what you see on these images here. What you see here is a knee joint. Joints in general are the junction of two or more bones, which often allow for movement, or also called articulation. Cartilage is firm connective tissue, primarily found in joints. Articular cartilage covers the contacting surface of bones. On this picture here, you see a meniscus. The meniscus is a crescent-shaped cartilage found in some joints, including the knee. And synovia is fluid secreted by synovial membrane and found in joint cavities. A bursa, or plural is bursae, is a fluid-filled sac that allows for easy movement of one part of a joint over another. A ligament. A ligament is a flexible, tough band of fibrous connective tissue that attaches one bone to another at a joint. A tendon is a band of fibrous connective tissue that attaches a muscle to a bone. Muscles. Muscles are tissue composed of specialized cells with the ability to contract to produce movement. There are three types of muscles: skeletal, smooth, and cardiac. A fascia is a band or a sheet of connective tissue that encloses the muscle or separates different layers of those muscles. So it's like a membrane that contains the muscle tissue. Skeletal muscle attaches to a bone by tendons, allows the body to move. These are voluntary muscles, so your brain tells you when you want to move. Smooth muscles are located in internal organs like the walls of blood vessels, the digestive tract, the respiratory tract. These are involuntary because you do not need to think about, peristalsis in your gut. It just does it automatically. Cardiac muscle forms most of the wall of the heart. It is involuntary contraction that produces the heartbeat. This is also called myocardium. Really cool, really specific functions. It has automaticity. It doesn't need any external input. Contractibility. The heart muscle is really cool and interesting. What we see here are the anterior and posterior view of the muscles in the musculoskeletal system. Like I said, there are over 600 of them. So check out your book. There are some main muscles that you may have already heard of, like deltoid, biceps, vastus lateralis, rectus abdominis, linea alba in your abdomen, external abdominal obliques. There are a ton. We don't need to know all of them for this course, but maybe some of the main ones. Your trapezius in your back. Um, yeah, so check them out. Won't get into all of them. It's too many to go over. And some combining forms for this chapter: carpo, wrist; costo, ribs; cranio, skull; lumbo is the lumbar spine; osteo means bone; sterno is sternum; and the last one, vertebro, would be the vertebra or the spine. There are definitely a lot more in the chapter. A few more combining forms. Electro, referring to electricity. Hemo means blood. Kinesio, movement. Necro is death. Kypho is a hump or convexity. So, like kyphosis is a hump back. So, someone who's leaning forward. Lordo is a bent forward or concavity. So, that's somebody whose lower spine kind of bends inward and their butt sticks out. Scolio is a curvature of the spine, which is referring to like a lateral curvature. So they have sideways malformation. Prefixes and suffixes. Brady means slow. Dis is painful or difficult. Hyper is excessive or above. Sub is below. And then some suffixes. Asthenia is referring to weakness. Desis, surgical fixation or fusion. Malacia is softening. Penia is a decrease in number. And trophy is referring to development or growth. Diseases and disorders. Arthritis is inflammation of a joint. Bursitis is inflammation of a bursa. Fibromyalgia, pain in the fibrous tissue and muscles. Typically, this is a chronic condition. Myasthenia is muscle weakness. Osteoarthritis is inflammation of the bone and the joint. Osteomyelitis is inflammation of the bone marrow. This is typically caused by a bacterial infection. Osteonecrosis is death of bone tissue caused by a decrease in blood flow. And rhabdomyolysis is dissolution of striated muscle. So the muscle is broken down and it makes its way into the circulature. Within the blood, and it can cause damage to the kidneys. Typically, this will happen after a serious injury or dehydration. Some more diseases and disorders. Bunions, abnormal prominence of a joint, typically on the foot. Carpal tunnel syndrome is a median nerve entrapment of the wrist caused by repetitive motion. It can cause pain, tingling in the hands and wrist. Compartment syndrome, increased pressure within a muscle. So those fascia, that connective tissue that encapsulates the muscle, if there's inflammation or swelling within that capsule and the pressure becomes too great, they can get something called compartment syndrome, which can cause serious pain and even like loss of limb. Dislocation is a displacement of bones from the joint. Fracture means broken bone. There are a bunch of different types of fractures. It's like a common misconception. People think, oh, did you break your bone? No, I just fractured it. A fracture is a broken bone. There are different degrees and classifications of fractures. So some are worse than others. But if you have a fracture, you do have a broken bone. Surgical term. So arthrocentesis is a puncture to aspirate joint fluid. So someone has a swollen joint or they need to check the fluid for some kind of pathology, they can do an arthrocentesis. Craniotomy, incision into the cranium or the skull. Laminectomy, excision of the lamina. So this is back surgery. It's usually to relieve pressure from like a herniated disc. Myography is suturing of a muscle. Vertebroplasty, surgical repair of a vertebra, so a broken vertebra. Complementary terms, arthralgia is joint pain. Atrophy is without development or wasting away. Myalgia, muscle pain. Hypertrophy, excessive development or overgrowth. Intercostal, between the ribs. Intracranial, within the skull. Sternal, referring to the breastbone. And last but not least, some abbreviations. FX, fracture. OA, osteoarthritis. RA, rheumatoid arthritis. THA is a total hip arthroplasty. TKA is a total knee arthroplasty. Ortho is referring to orthopedics. So there are a lot more terms that I couldn't go over the whole thing. Make sure you're looking into the chapter, doing the exercises, getting your practice in, doing the quizzes. This chapter is pretty interesting, but it is long and there is a lot that goes into it. So get to studying.